Proprioceptive neuromuscular facilitation is a set of stretching techniques commonly used in clinical environments to enhance both active and passive range of motion in order to improve motor performance and aid rehabilitation. PNF helps to restore normal movement by focusing on the developing sequence of movement and how the agonist and antagonist muscles work together to produce volitional movement. PNF uses reflexive movement as a basis for learning more volitional movement. The idea is that one must be able to roll before he can crawl and crawl before he walks. Primarily, Pnf treatment techniques focus on three things. 1. Increase the motor learning of the agonist through repetition of an activity, repeated contractions, and rhythmic initiation. 2. Reverse the motor patterns of the antagonist. Two techniques are slow reversal and rhythmic stabilization, both of which use an isometric contraction. 3. Learning to relax muscles helps to increase range of motion and decrease spasticity. Various PNF stretching techniques based on Cabot's concept are: 1. Contract relax, passive placement of the restricted muscle into a position of stretch followed by an isotonic contraction of the restricted muscle. After the contraction period, the patient is instructed to relax the restricted muscle that was just contracting and activate the opposing muscle to move the limb into a greater position of stretch. Through Golgi tendon organ, the tight muscle is relaxed and allowed to lengthen. 2. Hold relax, very similar to the contract relax technique. This is utilized when the agonist is too weak to activate properly. The patient's restricted muscle is put in a position of stretch followed by an isometric contraction of the restricted muscle. After the allotted time, the restricted muscle is passively moved to a position of greater stretch. This technique utilizes the autogenic inhibition, which relaxes a muscle after a sustained contraction has been applied to it for longer than 6 seconds. 3. Contract relax agonist, antagonist contract, usually performed by a passive or active stretch of the target muscles, to move the limb into a starting position at first, followed by a submaximal isometric contraction of the target muscle, and finally an active stretch is used to move the limb into a new greater position. This technique uses autogenic and reciprocal inhibition. Reciprocal inhibition is the main cause of the greatest effect of this technique versus the other PNF techniques. 4. Rhythmic initiation begins with the therapist moving the patient through the desired movement using passive range of motion, followed by active assistive, active resisted range of motion, and finally active range of motion. 5. Slow reversals. This technique is based on Sherrington's principle of successive induction, i.e. that immediately after the flexor reflex is elicited, the excitability of the extensor reflex is increased. This technique is used to strengthen and build up endurance of weaker muscles and develop coordination and establish the normal reversal of antagonistic muscles in the performance of movement. Thanks for watching. Don't forget to subscribe.